My name is Nayoung Choi. My presentation title is Development and Application Effects of Nursing Simulation Program for Pneumonia Care Training using Premature N. Contents. First, introduction. Second, methodology. Third, results. Fourth, discussion and conclusion. First, introduction. Background. Traditionally, education in universities has been centered around lectures for some time. There is a limit to increasing nursing ability in a clinical setting. Therefore, developing an effective nursing clinical skill education program separate from lectures is urgent matter. Due to the fact that mistakes are not permitted in a real hospital clinical environment, nursing students experience anxiety and fear over dealing with real patients. Most of this fear stems from the students not being familiar with the environment, advanced technology and equipment, the patient's family, hospital, and nursing staff, and thus tend to make mistakes here and there. This study aims to develop and apply a simulation-based nursing training program using Premature N to simulate a scenario with a premature child patient with pneumonia. The study verifies the effect on the subject's academic motivation, clinical nursing skills, and knowledge before and after the simulation-based clinical training, and provides practical foundational data on simulation-based nursing education. Purpose of study. This study aims to develop a simulation-based nursing training of premature babies with pneumonia using a Premature N and compares the difference of academic motivation, clinical nursing skills, knowledge compared to traditional education before and after the simulation program. Methodology. Definition of terms. Simulation program. A simulation program is an education program using a simulator to reenact a clinical situation artificially using a mechanical device. In this study, researcher makes a program of simulation scenario using a Premature N with a premature baby patient is brought into the ICU for newborns, and the simulation aims to test the student's ability to understand the situation and mediate and treat the patient properly. Definition of terms. Premature N. The premature N refers to the mannequin developed by the American Academy of Pediatrics, AAP, that is very similar in size to a 25-week-old premature baby's body proportions and has the heart and using sound and cyanosis of a premature child. Research method. The study's general research process is divided into the representative professor system, design model called the analysis, design, development, implementation, evaluation, ADDIE, with 5 parts. Research design. This study is a non-equivalent control group pre-test, post-test design aimed to develop a nursing simulation scenario on premature children patients and compare the academic motivation, clinical skills, and knowledge before and after a lecture-based program is given to the control group and a simulation-based training is given to the experimental group. Development of program. A detailed education program was developed for nursing a premature baby with pneumonia in order to increase academic motivation, clinical practical ability, and knowledge. A simulation scenario was introduced in order to reflect the needs of such a program. Development of tool. Learning motivation. The questions' content validity were verified by 3 nursing professors, and a total of 14 questions were proposed for the study. This study's academic motivation Cronbach's alpha was 0.87. Clinical practical ability. The questions for clinical practical ability was verified by 3 nursing professors for its content validity. A total of 23 questions were used, and each question's answer had a range from 1 to 5 based on the Likert scale. A higher score indicating a higher clinical practical ability. This study's clinical practical ability had a Cronbach's alpha of 0.9. Knowledge. For knowledge, child nursing academic materials were referenced to create questions, and 3 separate nursing professors verified the content validity of the questions. This field included 20 questions and Chromebox alpha, but the field was 0.85. Development of simulation scenario. This study developed a simulation scenario based on pediatric nursing academic materials and received validity confirmation from 3 pediatric nursing process and 1 pediatrician in the process. The preliminary experiment was run on 5 students for intervals of 15 minutes of clinical nursing and 10 minutes of debriefing. Implementation. Sampling of research subject. This study was confirmed on students in their 4th year at a university after careful explanation about the schedule and process and receiving signature of consent. Research procedure. Collection of data. After receiving consent from the students, a brief orientation and survey questionnaire was given in order to collect prior data on academic motivation on premature babies with pneumonia, clinical nursing skills, and knowledge. Result. Test of hypothesis. Hypothesis 1. In order to confirm Hypothesis 1, the academic motivation scores between the control and experimental group were compared. It was observed that experimental group had an average academic motivation score of 48.44, plus minus 10.03, which was seen as significantly higher than the control group's score of 40.92, plus minus 5.32, and thus Hypothesis 1 was supported in this study. Hypothesis 2. In order to confirm Hypothesis 2 that the clinical practical ability scores between the two groups were compared, it was observed that the experimental group had a significantly higher clinical practical ability score of 88.40, plus minus 12.73, as opposed to the control group's score of 70.95, plus minus 7.1, and thus Hypothesis 2 was supported in this study. Hypothesis 3. In order to confirm Hypothesis 3 that the knowledge score of control and experimental group were compared, it was observed that the experimental group did not have a significantly higher knowledge score at 12.38 than the control group's score of 11.46, and thus Hypothesis 3 was rejected in this case. Result. This table indicated the comparison on nursing's motivation, clinical practical ability, and knowledge. Students' number is 49. Results is like this. Discussion and conclusion. This study played a significant role in showing that a simulation-based nursing training program on premature babies and pneumonia can have a positive effect on students' academic motivation and clinical practical ability. More research is required in order to understand simulation-based training programs in various fields of nursing, its positive and negative effects, and the different methods and time periods that may be applied for the near future. Reference is like this. Thanks for listening my presentation.